In Louisiana have diabetes, and thousands more are being diagnosed each year. In this segment, sponsored by Primary Care Plus, Dr. Stephanie Surratt is here to explain how diabetes is often preventable or manageable. Good morning.
Good morning.
Well, thanks for joining us. Good to see you again. What is diabetes? I mean, break it down. You know, so many people have it. We all know someone who has diabetes. What is it?
Okay, so diabetes is a chronic disease, and it's a disease of blood sugar. But what really happens in diabetes is that your body either doesn't have insulin or doesn't use it properly.
Okay.
So that affects how food is turned into energy in your body. So
if you are diabetic, that's not working correctly?
That's not working correctly. So when you go to eat normally, your body will digest the food and turn it into sugars, particularly carbohydrates. Then those sugars are absorbed into the bloodstream. So the role of insulin is to act as a key and allow the sugar to get into the cells. So when the insulin is not there or doesn't function, the sugar builds up in the bloodstream, and that can lead to problems over time, can lead to complications, problems with the heart and kidneys, and with the nerves.
So that's kind of the overarching explanation. Folks have certainly heard that there are two different types of diabetes, type 1 and type 2. What is the difference between those two?
Okay, so type 1 diabetes is an autoimmune disease. It happens when the body mistakenly destroys islet cells in the pancreas that produce insulin. So then there will not be any insulin. And usually people with type 1 diabetes have to take insulin.
Are they typically diagnosed much younger as a result?
Usually they are. Usually, you know, like it can be a variety of different ages, but typical onset is like late teens, early 20s.
Okay. And then type 2 diabetes?
Okay, that's an entirely different situation. So type 2 diabetes, the body does make insulin, at least to start with, but the cells don't use the insulin properly. Like cells in the liver and muscles and tissues don't use it properly. So over time, the pancreas makes less and less insulin.
I've heard of people who are pre-diabetic. What does that mean?
So pre-diabetic means that the person has elevated blood sugars, but not to the levels. There are specific standards that would that characterize normal blood sugars and diabetic blood sugars, and pre-diabetics are kind of in between there.
And the reason I ask is because I've heard that folks in that sort of pre-diabetic time frame can do things to kind of mitigate their risk from going forward into full-on diabetes, which makes me think that maybe those of us who aren't quite too pre-diabetic yet may also be able to mitigate our risk.
Oh, absolutely. I mean, we have talked about diet and exercise many times on this show, and this is a great place for diet and exercise, for eating appropriate portions of carbohydrates and limiting, refined sugar, and exercise.
Is it a good idea to maybe read labels to check things? Because sometimes, man, they really sneak those added sugars in there.
Yeah, they absolutely do. They absolutely do. And you can certainly look at the ingredients, and you can also look at the carb counts and the added sugars on the labels.
What do you mean by carb count?
So when you read a label, it will tell you exactly how many carbohydrates are in a food.
Okay, and if that's high, even if the sugars aren't, if that carb amount is high,
that's not good. Once it hits your body, it's going to be immediately converted into sugars.
Absolutely. Okay, so once you are diabetic, if you've gotten that diagnosis or someone that you love has gotten that diagnosis, what is the best way to take care of yourself and the best thing to do at that point?
Well, you need to work with a doctor. The best thing you can do is establish a good relationship with your doctor and go, you probably will have to have more frequent office visits.
Okay.
And you will have to have blood work to check your blood sugars. You may have to monitor your blood sugars at home, and you will need some certain special tests, special screenings of your eyes and your kidneys.
All right, so best thing to do is to have established care so that you can see if you're on the path toward diabetes, or if you already are, you have a doctor that you're working with. Thank you so much for explaining all of that.
You're very welcome.
It's certainly something that we all are touched by in some way, shape, or form. Primary Care Plus has 12 clinics across southern Louisiana, 5 clinics right here in the New Orleans area. So if you are looking for a doctor, you can find your nearest location at primarycareplus.com.